Hello, I'm Fiona Ballard. In this recording, we'll be looking at both the structures or components of our skeletal system as well as the functions. So the first and obviously major component that we think of when we're thinking of the skeletal system are the bones. But we also have three different types of cartilage that we'll have a look at, as well as ligaments. So ligaments are dense, regular connective tissue that joins bones to bones. And in fact, bones, cartilage, and ligaments are all different types of connective tissues. So let's have a look at the three different types of cartilage. So at the top, we can see an example of hyaline cartilage. Now, we can often call this articular cartilage when we're referring to the presence of this type of cartilage on the protecting the ends of bones in joints. But when we look at all three of these different types of cartilage, we can see in the pictures that they're typical types of connective tissue which have a lot of background matrix with a smaller number of cells spread within that background matrix. So articular cartilage gives strength with some flexibility, and it plays a protective role on the ends of bones in joints. So if we look at B, the fibrocartilage, this is full of collagen as well. We can see lots of collagen fibers present, labelled in that diagram. And this is a very, very strong tissue that's able to both absorb pressure and resist compression, resist being compressed. So an example of where we find fibrocartilage is in the discs between our vertebrae and also at the front of the pelvis at the pubic symphysis. So the last type of cartilage we can see in C is elastic cartilage, called this because it's got elastic fibers. We can see those present in the matrix. And the cells of cartilage are called chondrocytes, and where it says in lacuna, they're the little spaces within the cartilage matrix that the cells exist within. So elastic cartilage, because it's got these elastic fibers, gives some sort of stretch and recoil ability to the tissue. So the pinna of the ear, or the upper outer portion of our ear, is made of elastic cartilage. So we can apply pressure and bend that tissue, and when we remove the pressure, it returns back to its original shape. And that's because of the presence of the elastic fibers. So let's look at the functions of our skeletal system. So firstly, a major function of the skeletal system is to protect the more delicate or soft tissue that's underlying the bones. So a good example is the skull bones protecting the brain. Another good example is the sternum and ribs protecting our heart and lungs. Another important function of the skeletal system is to provide a structural framework, a support tissue that we can attach muscles to and can help support the more soft tissues that we have within the body. Another major function is to work together with muscles to allow movement to occur. So when muscles contract and pull on bones, we get movement along certain planes, depending on how the bones in the joint are held together. So some more important functions of our skeletal system is storing minerals. So in this picture, we can see a cut portion off the end of the head of the femur, showing various characteristics of the bone. So calcium phosphate is the major mineral that is stored within the bone. So therefore, having around about 99% of our body's calcium stored in the bones, this is a good reserve in case calcium ion levels drop in the bloodstream, and then some bone can be broken down to release additional calcium for the body. So calcium is very important to maintain ideal levels of, because it does things like allow muscle contraction and nerve transmission to take place. Now, if we have a look in the sort of yellowy section in the centre, that's where the lipid yellow bone marrow is. So it's a store of energy for the body, just like the lipids that are stored in our adipose cells, the layer of fat below the skin in the hypodermis. This is another form of storing lipids as an energy resource for the body. Now, in the red bone marrow that we can see contained within the spongy bone, this is where we have blood cell production, so both red and white blood cells and also platelets are able to be produced in the red bone marrow. Just out of interest, you don't have to know this, when we're babies and young children, we have more red marrow, and as we get older, more of the red marrow gets converted into yellow marrow. And I guess this makes sense because when we're fully grown as adults, we are not going to have to increase our blood volume and therefore have as great a demand to increase blood cell production. So we just more need to maintain our blood cell production as adults. So one thing we're going to need to differentiate between are the axial skeleton bones and the appendicular skeleton bones. So if we have a look at this figure, the axial skeleton bones are shown in that sort of beigey colour, and they include the bones that form the axis of the body. So all of the bones in the skull, all of the vertebral column bones, the sternum and the ribs. And the sternum and the ribs we often refer to as our thoracic cage. So then the appendicular bones are shown in that grey-green colour, and these bones are the pelvic and pectoral girdles and the limb bones, so the arm and leg bones that are attached to the pelvic and or attached to the axial skeleton by the pectoral and pelvic girdles. So which bones should you know? You should be able to identify all of the bones listed on the figure there, as well as the bones that we're going to identify from the skull on the next slide. So the skull bones you will need to know out of all of these ones. Don't panic, you don't need to know all of them, but you will need to know the frontal bone, you will need to know the parietal bone, the temporal bone, and the occipital bone. And when you do the nervous system, or when you, as you've done the nervous system, you understand that these bones are named for the lobe of the brain that they are protecting or that they are sitting above. So the other two bones in the skull that you should know are the two jaw bones, the mandible or lower jaw, and the maxilla or the upper jaw. So with our vertebra, as you can see from the figure, they're distinguished or differentiated into cervical vertebra, of which we've got 7. Then come the thoracic vertebra, of which we've got 12. Then the lumbar vertebra, of which we've got 5. And then we've got 1 fused sacral vertebra and a fused coccyx. Now, if you have a look at the figure on the right, or the section of the figure on the right, you have anterior curves, so the cervical and lumbar. Now, if you have a look at the figure on the right, or the section of the figure on the right, you'll clearly be able to see that the vertebral column is not straight. It has curves in it, and it actually has 2 normal anterior curves, so the cervical and lumbar curves, and it has 2 normal posterior curves, the thoracic and sacrococcygeal curves. So why isn't the vertebral column straight? Why does it have these normal curves? This is because the way that it's curved gives some flexibility to the vertebral column, and it allows strength for the functions that we need to use it for, but it also, having those curves allows it some ability to absorb shock that could be placed upon the vertebra. Now, you don't need to know this, but FYI, for your information, you might find it interesting to see that we can have abnormalities of vertebral curvatures occurring. So the one on the left is called scoliosis, which is an abnormal lateral or sideways bending in the vertebra, and this typically occurs in the region of the thoracic vertebra. In B, we've got kyphosis, which is an abnormal posterior curve in the thoracic region. And in C, we've got lordosis, which is an abnormal or excessive anterior curve in the lumbar region. So as we can see by the silhouette provided there for C, this can happen temporarily for women who are pregnant in the later stages of pregnancy, with the carrying the additional weight of the baby out the front of the body. So let's have a look then at what are our common bone markings. So bone markings are markings on the surface of the bone. They are part of the structure of the bone and they perform specific functions. So there's two main types. We firstly have openings or depressions and grooves in the bone, and this is to allow blood vessels and nerves to pass through, but also to allow for the placement of ligaments and tendons so that they don't get compressed. The second type of bone marking are called processes, and these have two major functions. Firstly, they are projections or growths of bone that are going to form parts of joints or articulations, or secondly, they are projections or bone growth that allow attachment points for ligaments joining bone to bone and for tendons joining muscle to bone. So firstly, we'll have a look at depressions and openings. And whilst we don't have all of them on the figure of the skull, we've got quite a few of them that we can have a look at. So firstly, we've got a great big depression in the skull that we can see by the orbit. So this is a protective socket for the eye, and this is formed by the joining of multiple bones. So another type of depression or opening is called a foramen, which is a hole through the bone. So we can see the mental foramen at the base of the mandible there. So if we're talking about more than one foramen, we refer to them as foramina. Now we've also got a really big foramen or hole in bone called the foramen magnum at the base of the skull, and this is what allows passageway for the spinal cord to go through. So another example of an opening is a fissure. So this is a narrow slit that we can see the example up there in the orbit. A canal is referring to a tube, and we've got one here in the optic canal. Fossa we don't have an example of, but it's referring to a trench in the bone. A sulcus is a groove in a bone, and again we don't have an example here. And the final one, zemiatus, which is a passageway through the bone. So let's have a look at these processes, the projections or growth on bone. So firstly, we'll look at the ones that are involved in forming attachment points. Crest is referring to the projections or growth on bone. So firstly, we'll look at the ones that are involved in forming attachment points for connective tissue, so attachment points for ligaments and tendons. So firstly, a crest is referring to a ridge of bone, And we've got an example here with the intertrochanteric crest. An epicondyle is a rough projection of bone, typically occurring above the condyle. We can see on the other side where we see the medial condyle and the lateral condyle shown. We'll have a look at those in the next slide. So here we're looking at the places that we can have attachment points of connective tissue. So we don't have an example of a spinous process here in the femur and patella, but we do find them on vertebra, and they are allowing attachment of muscles to the vertebra. The trochanter is a very large projection, so we can see that at the top of the femur, where just before the neck of the femur, where it says greater trochanter. A tubercle is referring to a rounded projection, and we've got an example here, the adductor tubercle. And tuberosity is also a projection, but a tubercle has a rounded surface, whereas a tuberosity has a rough, bumpy surface. So we've got an example of that up towards the top of the femur with the gluteal tuberosity. So the last thing we'll have a look at in this recording are the second types of processes or projections or bone growths, and these are the ones that are involved in forming joints or articulations where we can have movement occurring in the body. So the first example here is a condyle, and a condyle is a large, smooth, articular projection. So the condyle is where we're having areas of this bone involved in articulation or movement at a joint. Same for a facet. We don't have an example of a facet here with the femur and patella, but facets are found on ribs and vertebra where we have movement between the ribs and the vertebra in the spinal column. A head is the name given to a rounded articular projection that has a neck of bone that supports it. So here we can see the head of the femur is supported onto the rest of the femur by a neck of bone.